As a reminder to everybody, we're looking at the 2022 ASC ERS guidelines on pulmonary hypertension.
So in this episode, our roadmap will be as followed. We're going to talk about the broad treatment goals and how we assess where patients are in terms of their disease. We'll revisit functional classes, talk about a few risk calculators, and then we'll conclude this episode with introducing the various treatment classes.
Then you mentioned that her PCP referred her for an abnormal echo. And a quick reminder for all our learners, as we discussed in episode 1, that the highest yield finding on the echo was really the tricuspid regurgent jet velocity with a value greater than 2.8 meters per second, suggesting pulmonary hypertension.
Point you made about the WHO functional class. This is a super important metric for us. And so we'll talk about the risk scores a little bit more. But sometimes it can be tough to say what's ordinary activity, what's less than ordinary activity. And so certainly some guide points for people. Class 3, if you can't do your normal chores around the house or your normal shopping without shortness of breath, then you're definitely in that class 3.
For patients with PAH at diagnosis, the guidelines currently say that they're stratified for risk of death at 1 year. So patients are either going to be low risk, so that's less than 5%, intermediate risk, 5 to 20%, or what we'll consider high risk, which is going to be greater than 20%. And I like to think of the ESC ERS risk calculator bringing together 10 key variables. And I think an easy way for me to separate them in my mind is, again, in medicine, looking at things in 2 buckets. 1, what is the patient telling us? And 2, what are the data showing? But another commonly used tool is Reveal 2.0, which really builds on the ESC ERS framework. So it takes those same core clinical and diagnostic variables and layers in some additional context.
That time from diagnosis to getting to low risk is hugely impactful on the patient's morbidity and mortality. So that is our goal. And when she comes back, we're going to reassess her functional class and her risk status. And we're going to use different risk calculators to do this. So there are a couple different ones that do this. There's the Compara 2.0, which is a 4 risk strata calculator. There's Reveal Light 2. There's the French non-invasive criteria. All of these have pretty good data behind them. The ESC ERS guidelines recommend using the Compara 2.0. And this is incorporating functional class, NT-proBNP, and 6-minute walk. And then it's going to put us in low risk, low intermediate, high intermediate, and high risk. Even if the cath numbers look better or the echo looks a little better, if we haven't gotten down to that low risk, it's time for me to escalate that therapy a little bit more.
As we talked about in our upcoming episodes, we'll dive a little bit deeper into the different WHO groups of pulmonary hypertension, walk through more treatment options available for each. So make sure that you stay tuned for those episodes.